but you got to be able to relax. Now, if you look at it on here, where are we? You see how it, yeah, I have my glasses on. It is directly on top of the triquetrum. So when I palpate the back side or the posterior side of the pisiform, I am on the triquetrum. So pisiform, triquetrum. So I go to his distal wrist crease. He's got an easy one. I go on the direct opposite side of that. So I move his wrist, make sure I'm on the bone, and I'm on the triquetrum on the posterior side. Good? All right, now I'm going to palpate, that's the some lovers try positions, right? Now I'm going to palpate the distal row. Now the distal row is just like the foot. That means the first metacarpal is going to approximate with the first distal row one, and that is called the trapezium. So my bony landmark will be the proximal, or the base, of the first metacarpal. So I just take his thumb, I go to the base, and on him you can actually see the bump where the base is. I just palpate that down. There's the base, so I know dropping just off of that, do you feel that bone right there? That is the trapezium. So I grab it. And if I grab it, I can actually move his thumb. Do you see me moving his thumb? And that thumb swings on the trapezium with the greatest of ease. The trapeze. See? Good? So that is the trapezium. It's very thick. Do you see how thick it is from anterior to posterior? So it's swinging back and forth like that. Good? Now, the next one is at the base of the second. What do you think that is? Trapezoid. It's not as important of a bone. It's not a lot of problems here. Lots of problems here. But we still need to be able to palpate it. It's a flat bone. And so I go to the base of the second. Go to the base. Sure enough, there's the base. And I come just off or proximal to that base. And that is a very flat bone, and I'm on the trapezoid. Trying to get audience participation in there. The third, base of the third is a large, and probably Steve said it's the largest. This is an important bone, and that's an important bone. Scaphoid is a very important bone for weight bearing. Capitate is a very important bone for stability because all of the carpal bones flex or kind of extend and flex around the capitate. So, I go to the base, it's going to be a flat spot. Base of the third, and there's a flat, like a dimple. When I get to that dimple, I can extend, and that kind of pops into my hand, and I flex, and it pops into my hand. I extend, and it disappears. Put your finger right there. So you feel a dimple there, right? Mm-hmm. Then something firm comes to the surface. Dimple, firm. Now remember, it's flat, so it's not going to poke out as much. Firm, dimple.
Do you feel anything?
A little bit, I think so.
Remember, it's a big bone and it's flat. Firm, dimple. Firm, dimple. Good? All right. Then, just like the foot, the fourth and fifth approximate with the fourth. Last one, the hamate. So what it's be to make sure I'm not on the capitate, I just go to the fifth. Go to the base of the fifth. Boom, 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 boom. Drop off the base of the fifth. You feel that bone right there? And that is the hamate. Now the hamate has an important structure on the volar or palmar side. It has this little hook. That hook is important in two ways. One is it forms, it's the anchor or pillar for the piezohamate ligament. in which through that little groove is where your ulnar nerve runs, and then it forms the pillar across this way, at least one of the 4 pillars, for your carpal tunnel, or the transverse carpal ligament. So that's important. That's why it has to be so high. Do you see how high it is there? Little hook. Little hook
There are
there.
pillars, yeah.
So I find that. What do you think would be a good? Oh, sorry. What would be a good bony landmark to find the hook of the hamate? Pisiform. It's right next to it. So if I can find the pisiform going at an angle towards the index finger, obliquely, about 1 thumb, drop off at 1 thumb, I should be right on it. So there's the pisiform. Drop off 1 thumb. Do you feel that?
I think so.
That is the hook of the hamate. So I got the pisiform, hook of the hamate, ridge of the trapezium, and tubercle of the trapezium, and I have the 4 pillars of the transverse carpal ligament or carpal tunnel. Now those are listed for you in your syllabus, in the lecture part. So that when I ask you to find that ligament, well, there's the pisiform, there's the hook of the hamate, there's the ridge of the scaphoid, there's the tubercle of the trapezium. So right there is your transverse carpal ligament. I'm going to put my finger in there and say that there is the transverse carpal ligament. I don't feel anything because it's full of the fascia of your palmaris longus and lots of beef attachments from your thenar and hypothenar eminence. But that is where it's at, and that's important to know that most people think that your carpal tunnel is here. That's not your carpal tunnel. Your pisiform is the first row of your carpal bones, so it's got to be just in that area. That's important to know because we're going to be ultrasounding here. We're going to be placing iontophoresis here in electrotherapy. We're going to be stretching that ligament next quarter. And what we'll do is we'll grab a hold of the pillars on this side with this thumb, the pillars on this side with this thumb, and we'll stretch it this way and then extend. Do you feel a little bit of a stretch there?
A little bit, yeah.
And that will be a treatment for carpal tunnel. All right, last 2 is the ligaments. Ulnar collateral, radial collateral. What do you think would be good landmarks?
Well, the ulna or the radius.
But let's be more specific, huh?
The head.
The head or the styloid process. Styloid process of the radius, styloid process of the ulna. And it's just going to go across from that styloid to the carpal bones and metacarpal. So I'm going to put my finger, oh, here's the head. Go around and find here's the styloid process. And then I radially deviate. Put your finger right there. When I radially deviate, that ligament should tighten up. Do you feel it?
I think so. Yeah.
Audrey, put your finger right here. I'm getting a lot of I think so's from Neil. Relax, Neil.
Audrey, put your finger where Ron's is.
Oh,
Do you feel like a ligament tightening up,
yeah.
Neil?
Get it together, Neil's what he's saying.
Does it feel like there's a tissue under there that's tightening up?
Yeah.
Okay. To the other side. Here's the styloid process of the radius. I'm going to put my finger just distal, and now I'm going to put your finger right there, Neil.
That one's
More
up.
prominent?
Yeah.
Okay. So I'm not lying to you is what I'm saying. All right. Okay?